Hello everyone, welcome to Level Up Learning. In this video, we are going to discuss the most important questions for DECE 2 exams. You can consider this video as a final revision for your exam. Here, I am going to show you some past year's questions with their proper presentation answers. If you need the PDF of this question answers, contact details are given below. You can contact there and take the PDFs. So let's begin with the first question. Write some do's and don'ts regarding diet and pregnancy. So let's begin with the answer. Do's. What are the things that the mother in pregnancy should do or include in her diet? Include more of cereals, milk and milk products. Give iron and folic acid tablets from second trimester onwards. Provide nutritious shakes in between meals. Include fiber-rich foods, particularly in last trimester to avoid constipation. Include small but more frequent meals during the day. Encourage the woman to take adequate rest after each meal. This helps in better utilization of food. So these are some do's that a pregnant lady should do. And let's talk about don'ts. Avoid the consumption of foods with strong flavors if the woman finds them difficult to tolerate. Avoid serving too much of tea or coffee. Restrict the use of fried and fatty acids. Avoid consumption of drugs and alcohol as they are very harmful for the health of our children or a baby. Discourage smoking. So here the answer ends. Next question. At what age various immunizations should be given? At the time of birth, what immunization should be given? BCG, poliomyelitis, oral drops. At 1.5 month old, poliomyelitis, oral drops and DPT. 2.5 months old, DPT, poliomyelitis, oral drops. 9 months, vaccine for measles. 16 to 24 months, DPT vaccine polio booster. 10 years, tetanus. Typhoid. Direct question can be asked from here. Okay, another very important question. Write major disorders during pregnancy. What are the major disorders that occur during the pregnancy? I have shown a flow chart, a very beautiful flow chart to enhance the answer. You can see anemia, polyhydramnios, vaginal bleeding and malpresentation. Okay, anemia. During pregnancy, blood test is routinely done to find out the hemoglobin content of the blood. Required level of blood 12 grams per 100 ml of blood. If there is not enough hemoglobin in the mother's blood, there may not be enough oxygen reaching the fetus for its growth and development. Correct? Next is polyhydramnios. It is the excessive amount of fluid in the uterus, can occur during the 7th month of pregnancy, and this can continue to increase until the time of delivery. What are the symptoms that are included in it? Abdomen, skin looks thin and stretched, swelling of the limbs. Due to increased pressure of fluid is amniotic sac, the water can rupture easily, which can endanger the life of the baby. Vaginal bleeding. If vaginal bleeding occurs in the first half of the pregnancy, it can lead to abortion and is due to insufficient level of hormones. If vaginal bleeding occurs in the last 3 months of pregnancy, is due to detachment of placenta from the walls of uterus. What to do? If a pregnant woman has vaginal bleeding, what to do? Let her lie flat with feet slightly raised. Arrange transportation for hospital and call doctor. Malpresentation. Ideally, the baby lies in the uterus in the head below position. in some cases it is not like that this should be given proper care and be referred to the hospital after the checkup. Correct? Okay. And conclusion for a better answer, proper food and care should be given to pregnant women in order to avoid any kind of disorder and disease for the proper growth of baby and good health of women. If you will present your question like this, you will get very good marks in your exam. Okay, next important question. State 5 symptoms of severe illness in the child. What are the 5 symptoms that shows that the child is severely ill? First, difficulty in breathing. If a child unable to breathe properly, it is sign that the child has some problem or disease. Fever with fast breathing. If a child is suffering from fever and also her breathing rate increases to more than 50 times per minute, then this is a symptom of severe illness. Third, bluish lips and face, very pale body. When a child has bluish lips, pale body, it is a sign of severe illness. Fits, convulsions. Fits shows the sign of any serious or severe problem. Drowsy, due to illness, child seems to be drowsy every time. Okay, another important question, as it is a revision for you, so I am trying to cover as much as possible so that you can get good marks. Suggest a balanced lunch menu for a lactating mother. So let's see the balanced diet. On one side I have written food, on other side I have written amount in grams. First, cereals 230 grams, roots and tubers 120 gram, milk 625 ml, pulses 60 ml, green leafy vegetables 200, vegetables 290, fruits 170 to 190. Total energy calorie intake 430, total protein grams 70. In this way we are going to design the balanced diet of a lactating woman. Now see the balanced lunch menu, how your balanced lunch menu will look. Pulses amount 15 gram, you can say legume, you can include legume. Okay, green leafy vegetables 100 grams, spinach. Cereals 65 gram, rice, chapati. Sugar jaggery 10 gram, besan, spinach, layered burfi. Milk 270 ml. Okay, in this way another answer ends. Now another important question, describe the functions of fats and also write the food sources of fat. Okay, what are the main functions of fats? Source of energy, insulation and padding, digestion, absorption, carrier of fat soluble vitamins. Source of energy, fat is concentrated source of energy. Each gram of fat provides approximately 9 kilojoule energy. Insulation and padding, fat is stored in the body in adipose tissue at specific places. Layers of stored fat under skin act as an insulator and keep the body warm. Digestion and absorption, fats are broken down to fatty acids. A secretion from the liver called bile helps in fat digestion by breaking fat into small droplets. Carrier of fat soluble vitamins, fats serve as carriers of fat soluble vitamins in the body and helps in their absorption. Some vitamins are soluble in fats. Now what are the food sources of fats? Ghee, mustard oil, coconut oil, soya oil, curd, paneer, these all contain fats. Nuts, eggs. So in this video we have discussed so many important questions which are important for your exam. If you want to purchase the PDF of this important question answers, contact details are given below in description below. You can contact there and take the PDF. Thank you so much for watching.